one of the most important chapter of physiology. So starting with the sensory physiology, everything starts from the receptor. Suppose if you are touching me, so receptor will be on my skin. It will be taken by the afferent to the spinal cord. In the spinal cord, there will be the ascending pathway. Then the thalamus is the relay station. It is like the antenna, and the cortex is like the television. So if someone is touching me and I am feeling that touch, it will be in the cortex. So receptor, afferent, ascending tract, thalamus, and the cortex. So this is going to be the sequence. So there are two types of senses. One is called as general senses, other is called as special senses. Special senses are in your skull. They are in your skull, like vision, hearing, equilibrium, olfaction, and they contain a special end organ. Okay, general can be touch, pain, temperature, 2-point discrimination, vibration, proprioception. So these are called as general sensation. So as I have discussed that they will start from the receptor, the first order neuron, then they go to the spinal cord, then the dorsal column or anterolateral column, and then they relay in the thalamus. Thalamus is the relay station for all the conscious proprioception. So there are two ascending tract, one is called as anterolateral, other is called as dorsal column. So ultimately it will end up in the cortex. So cortex is like a television. If you are seeing a movie on the television, so there is an antenna like a thalamus. Okay, it is a relay station. So this is very, very important concept so that we can understand further about the sensory physiology. Now cutaneous receptor, these are of various types. For example, there can be mechano. If there is a change in the mechanical, for example, tactile for touch, pressure, nociceptor. Noci means pain receptor. Proprioceptor. So if I am standing like this, it means that I am aware of all my position. So position of your own body in the space, 3 dimension is called as proprioception. For that you need Golgi tendon organ, muscle spindle. So these are called as proprioceptor, muscle spindle, Golgi tendon organ, joint capsules. Then thermoreceptors like cold and warm. Cold is for A delta, warm is type C fiber, and the receptor are called as TRP, TRPV or TRPM. TRPM means menthol. So for cold receptor you have TRPM, for hot you have TRPV. V means vanilloid. If you are sensing the hot, it is TRPV. Cold is TRPM. Then chemoreceptors can be smell, for taste. Then we have osmoreceptors in the hypothalamus. Then photoreceptors are like retina. They are for object, so they are called as stereoreceptor, electromagnetic receptor, rod and cone. Then there can be polymodal. The same receptor can sense multiple modalities. They are called as polymodal. So this is the basic idea of the receptors. Now starting with the location properties of the receptor, like location, modality, intensity, duration. So you can remember, for example, in your MBBS curriculum, they want you to ask in a full question, write about the neuroreceptors. What are the neuroreceptors? What are the properties of the receptors? Then you can write MLID, M-L-I-D. The properties are M-L-I-D. M is modality. This receptor is for what? For example, I am a doctor. Someone is a judge, else engineer, whatever. So my modality is that I am a doctor. So it is about the modality like touch, pain, temperature. What is the modality of the receptor? So some receptor is for touch, for pain, for vibration. So that is called as modality. Second is called as location. Okay, in one particular area, how many receptors are located? It is important for receptive field size. The area of skin from where receptors collect information is called as receptor density, and this is the basis for 2-point discrimination. Okay, smaller is the size, better will be 2-point discrimination. Smaller is the size because they have dense receptors. It is shortest in the lips, fingertips, only 1 to 2 mm, and greatest at the back, 50 to 60 mm. So more is the density of the receptor, shortest will be the distance for 2-point discrimination. It is shortest in the lips, fingertips, greatest at the back, 50 to 60 millimeter, the scapula, and it also depends on the cortical representation. In our cortex we have different area for different organ. Maximum for fingertips, for your tongue, for your lips, minimum for your trunk. So depending on the location of the cortex and receptor density, we have a point called as 2-point discrimination. 2-point discrimination means that you are able to discriminate that there are 2 points. You will say 2 point, 2 point, no, you will say 1 point, although there are 2 points. So this is the distance called as 2-point discrimination. Larger the representation in the cortex, better is the 2-point discrimination for texture determination. So this was about location. Now coming to the third, intensity. Amplitude of the stimulus is constant because they follow all or none law. Now if I increase the amplitude, can the feeling will be more? No, because they follow all or none law. So how can you increase the intensity? Not by increasing the amplitude, but by increasing the frequency. You will give more frequency. So when there is a more frequency, then only intensity can be increased, doctor. If there is a less frequency, intensity will be decreased. So it does not depends on increase in amplitude, because once it touches the threshold, it is the maximum. They follow all or none law. Last is the duration. Time since the start and ending of the stimulus is called as duration. So never forget for your exam, doctor, M-lid, modality, location, intensity and duration. Now the next point is about the, after the properties there is a location of the receptor. See, in epidermis we have 2 receptors, Merkel disc and Meissner's corpuscle. Merkel corpus and Meissner's corpuscle. Both are for touch. Merkel is for touch, Meissner's for touch. But what is the difference? Meissner's can sense lateral motion. They are most numerous on lips, fingertips, helps in topognosis. So if you are feeling something like that, I will give you a cloth and I ask you to close your eyes and see, this is cotton or terracotta or a leather. You will feel like lateral motion. So which receptor you are involving in the fingers? It is your Meissner's corpuscles. What is that? Meissner's corpuscles. Second is the Merkel disc. It is also for the touch. But which type of touch? It will sense the edge, corner, the point. It is for the Braille method. But the blind people, they will touch and they will read the book. So if I put this pencil like that and close your eyes and I will touch and you are feeling the edge, the corner or the tip, which receptor you are using, doctor? Answer will be Merkel disc. So Merkel, Meissner's, MM, both are superficial. Both are superficial. One is lateral motion, other is for edge, corner, Braille method. You will never forget now. Okay. Now in the dermis we have deep receptor, Pacinian and Ruffini end organ. Pacinian is the shape of onion. It sense vibration. Pacinian, shape of onion, sense vibration. It looks like this. It looks like this. Okay. And Ruffini end organ, sense skin stretch and the pressure and shape of grasp object. Okay. So pressure is sensed by Ruffini end organ. Shape of the grasp object, Ruffini end organ. So 4 receptors I have discussed till now. MM, Merkel, Meissner's in the epidermis. Pacinian and Ruffini in the dermis. They are the deep receptors. Now there are 2 corpuscles, Meissner's corpuscles and Pacinian corpuscles. Both are rapid adapting receptor, other are slow adapting receptors. So remember like that. They are again of 2 types, rapid adapting and slow adapting. 2 are rapid adapting. They adapt very easily. If you are putting your cloth, after that you will forget. But if someone is touching with a knife, you will not forget. Slow adapting. It is rapid adapting. You are wearing a specs, you will forget sometimes that you are wearing a spec. You are rapidly adapted. So remember, if at the end you are having corpuscles, it means they are rapid adapting. Also called as phasic receptor. It will come in a phase. At a time you will remember and then you will forget that you are wearing a spec, then you will forget again. You remember that you are wearing a coat or a t-shirt or whatever. So it is the phasic, rapid adapting. Other 2 are slow adapting or tonic. you are getting tonic stimulus again and again and again. And remember, they are Merkel disc, Ruffini end organ, and one more entity, free nerve ending. Till now, I have discussed about these four. Four are for touch, but for pain, we have free nerve endings. Is this clear, doctor? And afferent of all these receptors are single A beta. Afferent of all these four receptors is A beta. But for pain, we have A delta and C. So you can see the Meissner's corpuscles, Merkel disc, M and M, superficial. Pacinian and the Ruffini, they are deeper. Now you will not forget. Pacinian is the shape of onion, sense vibration. Okay. Meissner's and Merkel both are for touch. Meissner's are for lateral motion. Merkel is for edge pointed object like that. Pacinian, onion, vibration. Ruffini is for stretch and all.